Hi, my name is Dr. Jeannette Mahoney, and I am an associate professor of neurology at Albert Einstein College of Medicine in Bronx, New York. I'm also the founder of a digital health screening tool called CatchU, which is aiming to catch seniors before they fall. Falls are a significant problem both internationally and domestically. Here in the United States, we spend over $50 billion a year on falls and fall-related injuries in seniors. 30% of our seniors age 65 and older will go on to have a fall, and over 3 million of them will require an emergency room visit because of such fall. Now, once they fall once, it's more likely that they'll have another fall, and these falls can be fatal. Currently, there are lots of barriers to screening for falls in older adults. Mainly, there's a lack of a quantitative and objective performance-based measurement that can predict falls. Currently, we rely on subjective measures of falls, like asking our older adults, have they had a fall in the past 1 year, or do they have a fear of falling? Now, there are some performance-based measures out there that look into whether or not a person might fall, but often these equipment are quite expensive and require time from both the doctors and the staff to administer. We know that falls counseling significantly reduces fall risk. However, it's not systematically integrated in clinic today. Now, over the past 15 years, I've been studying how the brain integrates information from various senses like vision and somatosensory inputs, which is touch. What happens is when older adults receive both a light and a vibration at the same time, they can respond to that event faster than to either event alone. This research has shown that older adults that can actually benefit from receiving both the light and the vibration at once go on to have better balance, faster gait, and less falls. However, all of this research has been done in the lab. Now we'd like to get this tool out to the people in a clinical setting. So we've developed the first and only quantitative reaction time-based measure to measure multisensory integration, as we call it, the ability to integrate both vision and somatosensation, and to identify seniors that are at risk for falling. The test is easy. You're asked to focus your eyes on this fixation cross, and every time you'll see the lights flash, you would hit here, the response area. If the phone vibrates, you would also hit here, which is the response area. Now, sometimes those two will happen at the same time. This is when most people will benefit from receiving information from more than one event. That's both the light and the vibration together. As soon as this happens, you're to hit the response pad. This test goes on for about 10 minutes. And what we're doing is providing an accurate, a quick, an accessible, and a protected test to the people so that we can measure whether or not someone is at risk for having a fall. The information from this test will be transmitted to the patient's provider. And what it does is it provides a confidential test result report that the physician gets with various recommendations that have been adapted from the CDC study guidelines. And if you are not, as you can see here, a good, what we call integrator, what happens is we have a list of recommendations that we send to the physician, who can then choose which recommendations and which strategies would be most beneficial to helping their patients not have a fall. I thank you for this quick presentation, and I offer you to please reach out to me with any questions that you might have. Thank you very much.